This is a Medicare presentation that can be used for either Medicare supplement or Medicare Advantage or prescription drug benefits. You will determine which product the customer needs as you get into the presentation with the customer. So the first step might be to confirm your appointment. So at this point, my appointment has been confirmed with Mrs. Customer and Mr. Customer, and I have already asked them to please have their Medicare card, red, white, and blue card, handy. This is what you will need for your customer to have when you go to meet with them. So make sure that when you're confirming the appointment, just remind them to have their Medicare card handy. If they do not have the Medicare card or cannot find the Medicare card, it doesn't mean that you cancel the appointment, but just remind them, and then you're aware before you get there that they don't have the Medicare card. So our agenda today for the presentation training, we're going to talk about the steps to a great presentation. We'll talk about the CMS requirements. We will do an introduction. We'll go through fact-finding, educating the customer, product selection, scope of appointment, plan benefits and features, and then the application. So let's begin. In the steps to the presentation, you as the presenter must be courteous, you must be professional, you must always be respectful, but set the expectations for the meeting at the very beginning. Go in with an assumptive attitude. In other words, assume the sale. Smile. Be as courteous to the individual as you would want someone to be to you. It is very easy for a customer to smell commission breath. What we call in the industry commission breath is when you are only there to collect the commission. You're not really taking the time to understand your customer, to know what your customer's needs are, and make the best professional and intelligent suggestion to the customer. Always keep your presentation and your conversation in control. Yes, you're going to have chit-chat. Yes, you're going to do compliments. Yes, you're going to have small talk, but bring the customer always back to the point of doing business. Remember, you're there for business. Listen for the customer's emotional expressions. Watch the customer for emotional expressions. Listen very carefully for any pain points. You don't necessarily have to be the one to bring them up in the questions that you're going to ask as you are fact-finding. You will hear if there are pain points from the customer. Identify the customer's problem in your mind before repeating that problem back to the customer. Make sure that you understand what the needs are so that you're able to fill the gaps for that customer. Sales is a process of actually satisfying a need. So you have to be able to identify the need and don't make an assumption that every customer has the same need, because every customer does not. Repeat repeat the pain points that you've heard with expression, and remind the customer that they were the ones that said they don't like what they have now. Once you've gone through controlling the conversation and guiding to the right product, then you're ready to write the application. Next, let's talk about the CMS requirements. There are some requirements that are changing for 2023, and we'll get into those specifically when I actually get to presenting the plan to the individual. But there are some definite new requirements starting October 1st. Even if you're writing plans with October, November or December effective dates. One of them is if you're doing a presentation by phone for Medicare Advantage or prescription drug plan, the entire presentation must be recorded. And the recording must be maintained for 10 years. The other one is during the first 60 seconds of the presentation, whether it be by phone or in person, there's new verbiage that you must use, we're required to use. And we're also required to include that verbiage on all of our marketing materials. It needs to be on any flyers that you produce, any brochures that you produce, and that is that you do not represent all plans that may be available to the customer in that area, and if they want to find out all the plans that are available to them, they should contact 1-800-MEDICARE or Medicare.gov. I've kind of paraphrased it, but that's the language that we must say during the first 60 seconds of our conversation before we start the benefits presentation. So CMS does require that you identify yourself, which is a good idea before you start. As soon as you meet the person, make it a habit to have your business card in your hand. If you have a name tag or one that you wear around your neck, make sure that you have that available. I mean, if you want to get a lanyard, get your picture and your license number and put it in a lanyard and wear it around your neck. That's even better, because that substantiates the fact that you are who you are. CMS does require that a scope of appointment be signed by the customer. The customer has to identify all of the benefits that they want you to talk to them about. Often when it's a new person to Medicare and they don't know which option they're going to have, we'll check everything on the form, because you will be talking about Medicare Advantage, prescription drug, and Medicare supplements. You can only cover those things that the customer indicates on the scope of appointment that you can talk about. You are required to produce and tell the customer about the STARS rating for the plan that you're going to present. And at the beginning of our AEP enrollment, the 2023 STARS ratings will not be available. Most of the literature that you have will have 2022 STARS ratings. Each carrier will let you know when the 2023 stars rating sheets are available in November when they do come out, and then you reorder supplies. Those supplies will have the 2023, but when the 2023 comes out, you must download it, print it, and include it for the customer. It is required that you talk about the prescription drug coverage and the stages of implementation. Confirm with the customer. This is not a CMS requirement, but it's one that will help you to not have any misunderstandings between what the customer has chosen and what they think they have chosen. Confirm before you leave that customer the plan, show them the name of the plan so they will understand. They don't just have Aetna, they have Aetna PPO, Choice PPO, or whatever the name of the plan is. Okay, let's do an introduction. Of course, you will show your business card or some form of ID, the lanyard with your picture and your name and perhaps your state license number or something to introduce yourself. And you will say, hello, Mr. and Mrs. Customer. At some point, if you've spoken to this person before, you might have already asked them, how would you like to be addressed? Because some people will say, oh, don't call me Mrs. Customer, just call me Sally, or just call me Joe. So you'll know. And if that's the case, then obviously address the individual by their preference. My name is Faye, and I represent several companies and plans, and I will give you information to help you make an informed decision today. Now, starting October 1st, I will have to say, I do not represent all plans available in your area. To get information about all the plans available to you, you can call 1-800-MEDICARE or go to medicare.gov. For fact-finding, there's a tool that you can use that's free. It's 5 things you need to know. These are the questions that you're going to ask. And if you think about it in terms of N, E, A, B, S, those are the 5 things. So N is, the first question you would ask is, what is it that you have now? And it's important to ask what you have now, even if what they have now is not a Medicare plan. It's important for you to ask that question because even if they have an employer plan currently and it's an HMO or a PPO, it gives you the knowledge that the individual understands that concept of healthcare delivery. So N is, what is it that you have now, Mr. Customer? E is, what is it that you enjoy? What do you like about the plan that you have? As you're taking these notes and you're going to ask these questions, initially when you start to do this, and if it's your first, second, third presentation, it may take you a little time, but eventually you're going to remember NEADS, and you can just roll the questions off the top of your head. So E is, what is it that you enjoy? What do you like about the plan? Then A is alter or adjust. Mrs. Customer, if you were designing your own healthcare plan today, what changes would you make over the plan that you have now? What would you add or what would you take away? What would that look like? What's important to you? This is also where you might ask, if you did not get the information when you asked what you like, this is where you might also ask the question, would you consider changing your doctors? How important are the providers that you're using to you? That's a key question, and in your fact finding, to find out if the provider is a deal breaker or not. And at that point, you can ask, who is your doctor? Don't make any assumptions that the doctor's going to be in the plan that you're ultimately going to choose. You're just taking notes now. You're writing all this information down so you know where to go. But eventually, you're going to hear enough that Dr. Smith is my doctor that you will know which plans Dr. Smith takes or in what networks Dr. Smith belongs. So he is who makes the decision about your healthcare coverage. Would you make that decision alone, or does someone else help you to make that decision? And then S is a summary of everything that you've heard the customer say to you. So S is, Mrs. Customer, you said to me that right now you're in your employer plan. You're going to move out of the employer plan because you plan on retiring November 1st. And when you retire, because you are eligible for Medicare, you will have your Medicare Part A and your Medicare Part B, and you want to look at Medicare programs. You've also said to me that the doctor you're using now you really don't like, so we can look to see what doctors are in the network of a plan that we might find that fits your needs. And at some point, Mrs. Customer, I just want to let you know, not at this point, if you would like me to, then I would like to tell you when we get to that point how your prescriptions will be covered in whichever plan you choose. So N is what do you have now, B is what do you like, what do you enjoy about it, A is what would you adjust, change, add, B is who makes the decisions. Find that out. If the individual says, well, I can't make a decision until my husband reviews it with me, you need to find out when can I talk to you and your husband. My daughter makes all of my decisions for me because she's the one that has to take me to my doctor's appointments. When is a good time that I can talk to your daughter? I would like to explain to her what the options are so she has a good understanding. I think that's great that you have someone who can help you. And then, of course, the S is summarizing back to the customer in the customer's words what they have said to you. So you're always now going to revert back to, if I heard you correctly, Mrs. Customer, this is what you said to me. So the next step is the education piece. For the education piece, you're going to explain to them what original Medicare is. And in each of the carriers' summary of benefit books, they have a page that resembles the page from the Medicare and You handbook, where the Medicare card is at the top. That's original Medicare. On the left is the supplement and the Part D, and then on the right of that is the Medicare Advantage plan. So those are the options. Someone who is getting with you needs to know they have options. Medicare, they can use just original Medicare if they want to, but you're going to be able to explain to them what that means in out-of-pocket costs for them. There's no limit to the out-of-pocket costs if they're cost-sharing Medicare Part A and Medicare Part B with original Medicare only. And if they fit the criteria, they could purchase a supplement to go with original Medicare. And then to complete that first choice of using original Medicare, using a Medicare supplement, they'd also need to purchase a Part D plan. So they would have 3 pieces of information, 3 cards, 3 different carriers, so to speak, because they'd have the original Medicare, the supplement, and the Part D. That's one choice. I didn't understand that. That's one choice of having a full comprehensive plan of coverage. The second choice to them would be the Medicare Advantage plan. So next, we're going to look at the product selection. So we've educated the customer on original Medicare, how original Medicare came about. The Medicare fund is made up of the taxes that they paid over their working life into the fund, the taxes their employer paid, and then Congress has a line item where they put money into the Medicare fund. Everybody who pays Part B premium goes into the Medicare fund. So that's how the Medicare fund is established. And we've explained how Medicare says, now from that fund, you can use original A and B, use a supplement that you pay for, and a prescription drug that you pay for, or you can choose the Medicare Advantage plan where Medicare will pay the insurance company from the Medicare fund to offer the same benefits that are in original Medicare Part A and Medicare Part B. So we reviewed that very well, and we've come to the conclusion that the customer has confirmed to us that they understand the options and they'd like to see a Medicare Advantage plan. So now we are going to look at an actual scope of appointment because we're getting ready to talk about benefits. We're going to talk about the specific benefits. Before we can talk about benefits, any dollar amounts, any days in the hospital, any of that stuff, we have to, any copays, any coinsurance, before we can mention any of that, we need a scope of appointment. So the scope of appointment, the customer tells us what they want us to discuss, and as I mentioned earlier, we can say to the customer, Because I want to give you all the information, we're going to talk about we're going to talk about the Medicare Sup, we're going to talk about the Medicare Advantage, we're going to talk about the prescription drugs. Just make sure that everything that the customer wants you to talk about is checked on the scope of appointment. So now we're going to talk about the summary, the benefits of the plan that you're going to have. Remember, this is the Medicare Advantage plan. It's called the AARP Medicare Advantage Focus HMO, which means that you must use providers in network and you must choose a primary care doctor that's in network. So these benefits are for the plan year 2022. There is no monthly premium. So you have no premium that you're going to send to the insurance company. Plan has no medical deductible, and the maximum covered medical expenses for you during this 12-month period through December 31 is $3,400. That's covered medical expenses. If your medical copays, coinsurances reach $3,400 for covered medical expenses, then the plan pays 100% for the rest of the year. There is an inpatient copay of $195 a day for the first 4 days. If there's an unlimited number of days that you can stay in the hospital, so from days 5 and beyond, you have no copay. That $195 per day goes towards your $3,500 max. There is no copay for a diagnostic colonoscopy, but otherwise it's $145 at the ambulatory surgical center of the hospital. For diagnostic colonoscopies outside of the hospital as an outpatient, it's $175, and that also includes surgeries. It's a $175 copay for outpatient hospital observation services as well. Now, there are some benefits within this plan that you have no copay. And the one that you're probably going to use most often is your primary care doctor. There's no copay for your primary care doctor. There's no copay for any of these preventive services. There is no copay for a routine physical. There's no copay for urgently needed services outside the United States. There's no copay for diagnostic tests and lab services, for such as mammograms. And there's no copay for lab services. There's no copay for hearing services. There's one routine hearing test per year at no copay. There's no copay for routine dental services. That's 2 cleanings a year. And 6 months apart, there's no copay for vision exams either. Now, I know that I skipped some benefits, but I wanted you to realize that there are a lot of benefits within the plan where you have no out-of-pocket cost. You do have an out-of-pocket cost of $90 for use of the emergency room, and that's if you're not admitted. If you're admitted, then you're going to pay the inpatient hospital copay. The emergency care copay is good in or outside the United States. There's a $40 copay for urgently needed care in the United States. There's a $75 copay for radiology services that are diagnostic, $50 copay for therapeutic radiology, $15 copay for x-rays. Now, if you require a hearing aid as a result of your zero copay hearing exam, your copay is $375 to $1,425. If you use the dental benefit for services including the preventive and the comprehensive, the maximum that the plan will pay is $1,000 during the calendar year. Everything except the exam, cleaning, x-ray, and fluoride is a 50% coinsurance between you and the insurance company. Your vision services, you have no copay for the exam, and there's $200 towards your routine eyewear. For mental health services, $195, the same as the medical inpatient, except that it only covers 90 days of inpatient hospital stay for mental conditions. For outpatient group therapies, $15, outpatient individual mental therapies, $25, and virtual mental health visits, no copay. There's no copay for the first 20 days of skilled nursing, and days 21 to 39 are $188 per day. And after the 39th day, then up to day 100, which is the maximum that Medicare will allow, there is no further copay. $20 for speech therapy, $195 for ambulance, ground or air. There's no transportation included in this particular plan. For chemotherapy or radiation therapy, there's a 20% coinsurance. All of these are out-of-pocket expenses that would go within your $3,400. So once you've gone through all those steps, then you're ready to take the application. Use electronic applications whenever and wherever possible. Please don't even start the habit of paper applications. Paper is not your friend. The electronics are your friend. If you need help with Medicare Center or any of the platforms, then just let me know, because you really do need to do the electronic. It'll save you a lot of time and a lot of headaches. So you want to explain to your customer, once you've done the application, what they should expect. So 4 to 5 days following the appointment, you should plan to follow up with your customer to give them a status of the application. And you can check the status on any of the carriers list. By 5 days, you should know if it's approved or if it's pending or whatever. But stay in touch with your customer. Within 10 to 14 days, the insurance company will send them ID cards. And then you should diary. I don't know if you're using a CRM or if you're using a spreadsheet, but you should set up a 30, 60, 90-day follow-up for this particular customer. Every customer should have a date, 30 days out, 60 days out, 90 days out, when you're going to touch base. If it's nothing more than a text to say, hello, I'm just checking on you. Just make sure that you stay in touch with your customer, because that first commission is not your only commission. You need to service them so that they will stay on the books, and that's how you build your residual income. You need to measure your success as you're going along, but don't get crazy over this, particularly for those of you who it's your first AEP. Keep track of the number of appointments you have each week, the number of those appointments that you actually sit with, the number of applications that you take from those sits, as well as any other applications versus the goal that you set for yourself. And then you can, from those metrics, you can determine what your closing percentage is. And you always want to keep improving your closing percentage. You're going to lose some, don't worry about it, but make sure that you've done, and you feel within yourself that you've done everything that's right for the customer, and that's a solid, rock solid sale. So all I can say is, go out there and make it happen.